Here, it's on that table over here. Yes, ma'am.
My name is Kelly Curran. I am the Global Project Director of the RISE project, which is funded by PEPFAR and USAID, and which has been working around the world for the past 5+ years to address not only the HIV epidemic, but also global health security needs, the COVID-19 pandemic, and Mpox outbreak. And here, the Nigeria program has really been our flagship HIV program. It has been an incredible program that began 5 years ago in 2019 in the wake of the Nigeria AIDS Impact and Indicator Survey. So the goal of this project, as I said, was really to address the gaps in the HIV response in Nigeria. Particularly in specific populations that were underserved in the current response: children, adolescents. RISE implemented comprehensive prevention, care, and treatment services in 5 states of Nigeria: in Adamawa, in Akwa Ibom, Cross River, in Niger, and in Taraba State. And Taraba State is the state that we have been working in most recently. The other 4 states have already transitioned to local partners, and we're very proud that some of the work that was begun and strengthened by the RISE project in those 4 states is now being led by local partners, which is as it should be at this point in the HIV response. So as we gather to reflect on this collective journey, I want us to share our results, to celebrate our results, to celebrate this partnership. This dissemination will provide us with an opportunity to take stock of implementation and to re-strategize for ongoing future HIV interventions.
Sharing our experience. I think while we are talking about 98%, 97% viral load suppression, viral load, whatever, what I see is that we've been able, at this point in our life, when a lot of families are going through a lot of economic hardship, we've been able to preserve lives. Without this, a lot of these children will have been orphaned long ago. I see a lot of children that are still going to school because they have the backbone of the family still around. I see a lot of women that have shoulders to cry on because their husbands are still alive. I see a lot of men that can go out for work knowing fully well that the family is well catered for because the mother is still there. Without these interventions to these families, there will be a lot of dark and gloom, and we will not be speaking about 98% viral load suppression, 98% this, 98% that. To me, the reflection is in those lives that we have saved, in those families that are happy today, that are relating, that children are running up and down and playing because this program has succeeded.
For the past 16 years, I've been living with HIV, and I always tell the people around me that I am the landlord and HIV is the tenant. And I always tell them I will not allow HIV to be the landlord. So if you want to be a landlord, you have to stand, take your drugs very well so that you will be the landlord and HIV will be the tenant in you. I'm standing here happily to tell you that I have 4 kids that are all HIV negative. I want to say a big thank you to USAID RISE. They have done so much. We've not lacked ARVs. ARVs always at our doorstep. It is available. I want to say to them, And I was able to put smiles on the face of many. Like the children in OTZ, I used to teach them how to do morning fresh, bar soap, and other things.
We've come a long way, actually, both the RISE project and USAID. Most importantly, RISE stands today as one project that we look at when we come to the issue of sustainability. The work that they started doing and that they are handing over to us, we are actually trying to see how we can make sure that they continue to be woven, the lessons learned, that they continue to be woven into the activities for service delivery in the states that we work in. RISE is a testament to USAID because RISE project became the only international project that USAID, the HIV and TB program, had that was still being implemented by an international partner. Running through successes from the project, I'm identifying the sustainability of the HIV response in the states, the facilities, and community that they work in. We are handing over all these activities and looking forward to continue to work with you towards their maintenance, especially the investments that have been made in the states that RISE has handed over or that are currently handing over.
Please give a round of thanks to our funders, to the American people who support the President's Emergency Plan for AIDS Relief, and to our donor, the United States Agency for International Development. They have been so supportive and integral to this project since the beginning, in the design, in the leadership, in helping us think through challenges, in helping us negotiate at the state and local levels to be able to work hand in hand with our government partners, and we're so grateful for them. I would also like to recognize the Federal Ministry of Health, the National Agency for the Control of AIDS, NACA, the National AIDS and STI Control Program. I'd like to also recognize the state SACAs and Ministry of Health at state and LGA levels. All consortium partners, the implementing partners, again, JPIGO and ICAP working as a team, I think has been a really incredible opportunity to see two very powerful HIV implementing partners work together.